protein supplements after gastric bypass surgery, a necessity. Every day, there are more and more cases of obesity being reported. In fact, approximately 34 million Americans are overweight, and almost 20 million of these people are at one stage or another of a diet of some sort. The scary fact is that more than 9 million young people, or 20% of the people in this age group in the US, who are between 6 and 19 years of age are considered overweight. Since 1980, the number of young people who have weight problems has more than tripled. When a child or teenager is overweight, this more often than not carries right on into adulthood, when it becomes even more difficult to shed unwanted pounds. Adults with weight problems also tend to have a number of health issues to deal with, including diabetes and heart disease. For many overweight adults, gastric bypass surgery is their best answer. In fact, this is one of the most common types of surgery performed in US hospitals today. When it was first introduced, gastric bypass surgery was an elective surgery, so many patients were unable to afford it, as most elective surgery is not covered on health plans. But, because it has been proven to be such a necessary surgery for so many people, it is now considered to be an important surgery, and is covered by many health plans, which is a plus, because this sort of surgery can cost anywhere between $10,000 and $30,000. Just like any surgery, there are risks involved with gastric bypass surgery. Some of these risks include gallbladder disease, diabetes, hypertension, cancer, cardiovascular disease, arthritis. It is more and more common these days to see overweight children who are developing adult-onset diabetes, and more children are showing early signs of heart disease. Some young people are even experiencing heart attacks due to their weight issues. Because it is so important for young people to maintain a healthy weight to grow into healthy adults, gastric bypass surgery is often an option. Types of bariatric surgery. There are many different types of bariatric surgery for weight loss, some reversible, some adjustable, and some temporary, although most surgeries of this type are permanent. Just like any surgery, perhaps even more so, bariatric surgery should be considered life-threatening, and it is not a decision to be taken lightly. Types of bariatric surgery include the Roux-en-Y gastric bypass surgery, the lap band system and the sleeve gastrectomy. Roux-en-Y gastric bypass surgery. This is a common surgery that works by making the stomach smaller so the patient is unable to eat as much, allowing him or her to lose weight. The stomach is stapled, creating a small pouch, which is in turn connected to the middle of the small intestine, the jejunum. This can be performed as an open procedure or as a laparoscopic procedure. The lap band system, a small silicone belt, or gastric band, is installed around the top of the stomach, which helps to control the patient's hunger, allowing them to feel fuller faster, and help them to lose weight. The band is adjustable, and as the patient loses weight, the band is made smaller. This must be done regularly to ensure that the band is not too loose. As a rule, patients will undergo between 6 and 8 adjustments to the lap band system in the first year and a half of it being in place. Depending on the type of surgery, many patients are able to return home the very same day. Laparoscopic surgery only takes about an hour to perform. The sleeve gastrectomy. This is a surgery that is done for patients who are far too overweight to be able to undergo other types of bariatric surgery safely. A surgeon will remove most of the patient's stomach, leaving only approximately 15% of it in place. This surgery is not reversible, but if the patient is successful in losing weight, it can be converted to other types of gastric bypass surgery. There is another type of bariatric surgery, which actually bypasses the stomach. This surgery involves an endoscopic technique that goes through the mouth. There are two ways to perform this type of surgery, either by inserting a small plastic tube from the throat to the small intestine, or by stitching the stomach wall together to form a small tube from the esophagus to the duodenum. The need for supplements and good nutrition. Patients who have undergone bariatric surgery will notice that they are unable to eat as much as they once could. The stomach will only hold a small portion of food following the surgery, but there are still many nutrients that the body needs in order to remain strong and healthy, and this is especially true with bariatric surgery patients. One way patients can get the nutrients they need without eating too much is to use protein supplements, especially as meal replacements. There are a number of different types of protein supplements available, including protein powders, meal replacement bars and snacks, and liquid protein supplements. One of the newer liquid supplements on the market today is ProfectR from Protica. This is an ideal supplement for patients recovering from bariatric surgery because it provides 25 grams of protein per 3-ounce serving, with only 100 calories. ProfectR is also available in a 50-gram vial, providing patients with 2 complete servings. This will give them half of the protein they need in their daily diet, without the need to eat a large meal. Not only does ProfectR provide loads of protein per serving, it is also loaded with vitamin C. In fact, one serving of ProfectR contains 100% of the recommended daily intake of vitamin C, as well as 10% of B vitamins. ProfectR contains no fat and has 0 carbohydrates.